It is World AIDS Day, and we're talking about advances in treatments. That's led to fewer deaths from HIV/AIDS since the epidemic began in the 1980s. But even so, Dr. Carlos Malvastuto, who treated HIV and AIDS patients, says awareness remains critical. Many people are living with HIV and don't know it.
You can trace 40% of new infections to people who actually were unaware of their own diagnosis. For a lot of people, HIV is almost an invisible condition. But what we know is that, we still have over 30,000 new infections in the U.S. every single year.
Dr. Malvastuto says we need to normalize testing and make sure that all people are able to get HIV care. HIV can affect anyone, regardless of their sexual orientation, their race, gender, or age. The CDC says talking openly about HIV, getting tested, and knowing your HIV status can help in the fight against AIDS. So to talk more about it is our 9 Health expert, Dr. Payal Kohli. It's good to see you again, as always, today. For so long, starting in the 1980s, HIV was considered a terminal illness. Certainly was plenty of stigma, the worst of possible stigmas around it. How's the public perception of the disease changed the way we treat people?
We've come such a long way from the 1980s when it really was that stigma. So HIV, human immunodeficiency virus, is a virus that attacks your immune cells, your infection-fighting cells. And so AIDS is kind of the consequence when that virus attacks enough of your immune-fighting cells where you get acquired immunodeficiency syndrome, where you get susceptible to infections, and that's how you succumb to the illness. So for the longest time, we would just say it's a chronic disease and it's terminal, and once you have it, there's nothing you can do about it. But the scientific advances have now made it so that it's just like diabetes or heart disease or high blood pressure, where people are living alongside HIV and not dying as a result of it.
Something you can manage for the rest of your life. How do people know if they're at risk for HIV? How does it spread?
Yeah, so, it's spread through sexual contact, through body fluids like blood, semen, vaginal fluids, and it can also be spread through broken skin, ulcerations in the skin, anything that really transfers blood, such as blood transfusions. But really the people that are most at risk for it are depending on their behavior or their occupation. So if you're an IV drug user, if you have multiple sexual partners, particularly if you have unprotected sexual intercourse, if you work in a hospital setting or work in a setting where you handle a lot of blood or specimens that could be contaminated, those are the biggest risk factors for HIV.
It seems like money makes a big difference in how science advances and medicine advances. When you think of some of the most well-known diseases, they're put in front of us often. You think of the Susan G. Komen, as far as breast cancer, and you think of HIV/AIDS as another one. You talked about heart disease and blood pressure and all these things. How big a difference has that made in that HIV and AIDS has stayed at the forefront of being financed and having medicine push forward?
We've made such a tremendous advance in HIV care. I mean, there's actually a way to cure HIV, and it's been reported to be cured in a couple of patients. We can certainly dive into that. I think the next level, however, Tom, what you're bringing up is that we need to take it to the next level where we get that vaccine, because we don't yet have a vaccine for HIV. There are measures we can do to protect ourselves and prevent infection or reduce risk. But that would really be the way to change the trajectory of the disease worldwide.
And that's because it was thought of as a terminal disease. If you got it, you were going to die, and you were probably going to die soon. And now it seems like that's just not the case anymore.
Not at all. You take your pills and you do what you're supposed to be doing. And those pills are antiviral pills. So they prevent the virus from replicating, which means it prevents it from destroying your immune cells. So it just kind of lives inside of you, but it's not necessarily that it might result in any consequences.
Until we get to a vaccine point, you mentioned preventative measures, and we had an earlier conversation in the same show about the advances that have been made there. Can you walk through that with us? Like, what are some of the things people can actually be doing? And a lot of people are.
So many preventive measures. So the best thing to know is to be aware of your risk factors, because if you're going into a high-risk situation where you may have unprotected intercourse, you can actually take what's called pre-exposure prophylaxis, which means you take an antiviral so that if you were to get exposed to HIV, it actually reduces the likelihood that it's going to take in your body. You can also have something called post-exposure prophylaxis. Once you've had some kind of an exposure, this happens often in the hospital settings. I've gotten a needle stick myself multiple times, drawing blood or something. You take that medicine to reduce the chance of turning positive. And then during your exposure, of course, whether it's intercourse or anything else, you really want to take measures to protect yourself. So protected intercourse reduces your risk of transmission significantly.
Talk about testing, because do you have to be at risk, or should you only be tested if you are at risk?
I think you really have to embrace testing, and this is why I love that we're talking about this, because we're destigmatizing HIV testing. It shouldn't just be for people who are behaving badly. It can be really for anyone. 2021. And it's important to know when to get tested because there's a window period. So if I get exposed today and I get tested today and it comes out negative, that doesn't reassure me. You actually want to wait until the virus has enough time to sort of replicate, cross that threshold where the test would turn positive. And there's different types of tests.
I was going to ask you about what type of testing there is and is it readily available?
Yeah, so it's all blood tests really, but there are different things we're looking for in the blood. So you can look for PCR testing, so you're looking for genetic material of the virus. You can also look for antigen testing, which is that more rapid testing, pieces of the virus that you might be able to detect. But you
Terms that people are so familiar with now, right? Post-COVID, things maybe wouldn't have really understood 5 years ago.
True. I can talk about it easily, but that window is about 10 days to 90 days when you really want to try to get tested. And if you test negative once, you may want to repeat it again.
Well, it's something that to have World AIDS Day, get people thinking about and get people talking about. And you talk about destigmatization. It comes with time and it comes with talk. And it seems like we've come a long way. And as we talked about earlier with Rex Fuller, I mean, it's something obviously you want to look ahead and see where we're going with it and hoping the progress continues. Good to see you, as always, Dr. Payal Kohli.